heart attacks, cardiovascular incidents, cardiovascular accidents, so heart attack, angina, stroke and mini stroke. So I'm just going to whiz through some of that today. Okay. First and foremost, let's start with heart attacks, because everybody's heard of it, also known as cardiac arrest, more formally known as a myocardial infarction. Myo meaning muscle, cardiac, myocardial referring to the cardiac muscle, which is the heart muscle. Infarction means death. Now, how does that differ from angina? So just to understand this concept, and the same with stroke and mini stroke, a quick bit of overview. So the blood vessels, the blood runs through the blood vessels. Blood is red. The red pigment that is called hemoglobin. Hemoglobin carries oxygen. The blood vessels, if they become narrowed, and therefore the blood supply becomes compromised due to processes such as atherosclerosis, which is plaque buildup on the inside of them, that will reduce the amount of blood passing through them. Now, when tissue respires, so respiration is the chemical process by which the body converts glucose in or in the absence, with or without oxygen, into energy in the form of ATP. That's respiration. Respiration, not breathing. That's inspiration, expiration. What happens is the tissue, as it's respiring, as it's active, as it's working, it's respiring, and so therefore it needs a constant supply of oxygen. And so what happens is the blood is carrying the oxygen to it. Now, if the blood vessel that's carrying that blood, which is oxygen rich, to so what we call oxygenated blood, to the respiring tissue, if that's reduced, then the respiratory demand of that tissue is not being met. Now, if this demand not being met is temporary and reversible, we refer to that as ischemia. So compromised respiratory demand is therefore known as ischemia. Ischemia is reversible temporary pain. In the context of the heart, the coronary artery, the artery that supply the heart muscle itself with blood vessel, the blood and the oxygen, if that is compromised, then that leads to ischemic pain, which is known as angina. So chest pain, known as angina. Angina, there are different forms: stable, unstable, crescendo, and so on and so forth. But all in all, angina is ischemic pain of the heart. This is temporary. This is reversible. If that coronary artery becomes completely occluded due to a thrombus, a blood clot, then that means no blood can actually pass through at all past that point, and therefore the tissues that were being supplied by the remaining vessels become infarct. So they die, and that's infarction. Infarction is irreversible, it's permanent. Can ischemia lead to infarction? Absolutely, because you've got narrowing, haven't you? And so what we do in the context of angina, we give the likes of GTN, so nitrates, which cause vasodilation, amongst other medications. In the context of MI, so heart attack, myocardial infarction, abbreviated MI, there are a few types of MI. The most common are STEMI and non-STEMI. STEMI, ST elevated, non-STEMI, non-ST elevated MI. We differentiate between these two on the back of an ECG, very clear, easy finding pathognomonic, and what we do is they manage very differently. STEMI is much more fatal, and so we send the patient off to a cath lab into theatre basically, in which case we perform a procedure called PCI, percutaneous coronary intervention, which essentially is like an angioplasty. So you stick in stents. You might have heard of little mesh cages, put a stent in, open up the blood vessel, allow the blood to continue through to that area. So in addition to that, we give fibrinolytics, so autoclave, reticulase, streptokinase. These are the actual big guys that break down thrombi. So that's a heart attack and angina. Now, in the context of the same event occurring in the brain, is known as a stroke or a mini stroke. So a stroke is equivalent to a heart attack and MI itself. So there's complete occlusion of the blood and the oxygen supply to a part of the brain tissue itself. Okay, so that is again permanent and irreversible, and in that situation, what we do is infarction. If infarction occurs, that leads to a neurological deficit. So that's why in stroke we get a one-sided neurological deficit that's permanent and irreversible. A mini stroke is essentially similar to angina, so it's ischemia, it's temporary, it's reversible, and the TIA, so mini strokes, formerly known as TIAs, transient ischemic attacks, and that's also, in essence, a stroke is the equivalent of a heart attack, an MI, and a ministroke, a TIA, is equivalent to angina. Okay, TIAs last 8 to 15 minutes, and these are, again, neurological deficits, but very short-lived, transient. And there's another feature with TIAs, a kind of a blind coming down in front of one eye. That's what we call amaurosis fugax. Finally, I'm going to go on to pulmonary embolism. So if you have a clotting in your calves, that deep vein thrombosis, that can be dislodged and it can enter the circulation, the pulmonary circulation, and pulmonary embolism. So a clot, a thrombosis, once it's dislodged, is classified and becomes an embolus, and that embolus goes and travels into the circulatory of the airways, the pulmonary circulation, and that again is equivalent of a MI really, except in the lungs, and that causes massive distress. Except the lungs have, again, in a similar fashion, got lots of vasculature. So in essence, a pulmonary embolism, again managed very differently, is equivalent to a heart attack. And that's your cardiovascular incidents and events in a nutshell. I hope that was helpful. Thank you for watching.